Good afternoon, good morning. Yes, today, we would like to initiate the second session, the coronavirus, the big data, the use of the big data to combat the coronavirus 19. So what are the impacts of consequences of coronavirus and a pandemic on our lives and our societies? What are some of the solutions we can find to boost our healthcare systems, secure our business, and maintain our jobs and education, and stabilize the financial markets and economies? Would like to talk about innovation cases and efforts that we have made to utilize big data to fall against the coronavirus 19 crisis, the response. Even prior to the COVID-19 crisis, the government and the businesses and academia have shown much interest in the utilization of the big data, giving lessons and creating an impression to the society through many innovative cases and efforts. The use of big data during the COVID-19 in particular has revealed high level of possibility and insight in the aspect of interest and investment and commitment. In the era of a post-coronavirus, that we can expect visible and successful achievements in many areas through big data, such as public communication and citizen engagement and collaborative governance, public-private partnership, and policy design and public service co-creation based on the evidence and the data by big data. All countries are compiling data analysis and recommendations on a range of topics to address the emerging health, economy, and societal crisis, facilitate coordination, and contributed to the necessary global action when confronting these enormous collective challenges. Right now, so we have invited 5 great presenters with wisdom, experience, and insight to be shared with you this afternoon. Before we begin, let me introduce briefly and myself briefly. So my name is Taejun Lee, from KDI, Korea Development Institute, School of Public Policy and Management. So I'm an associate professor of KDI School, and I am affiliated the researcher of KDI, and I've been an affiliated researcher of Open Government Unit at the Directorate of Public Governance of OECD. I have worked with the central government and local government and the public institutions in South Korea. I'm very honored to be in front of you, and also I am very happy to introduce the 5 presenters. Before we begin, so I would like to have a few announcements to make for this session. As you know, the session runs for an hour and 3/4. I want to use my slide. Just a moment, please. Okay, yep. So, can you see? I'm sorry. What happened? Okay, yep. So as you can see from this slide, the sessions run for an hour and 3/4 from to guarantee enough time for discussion and speech. The 3 presenters will give us speech and presentation for 10 minutes each, and we will have a Q&A session to address questions and opinions of a participant and relevant to each presentation. Then the other 2 presenters will give a speech for 10 minutes each, followed by another Q&A session. I would like to allocate 10 minutes to each presenter in a Q&A session for deep understanding and sharing insight thoroughly. I will then wrap up the session for 5 minutes and round off the session. So this is the basic time frame. And the first presenter from the KPMG Korea the Mr. Mungu Park. He's going to talk about Korea measures against COVID-19. He's going to deliver the very insightful cases on medical logistics and the rapid analysis and the real-time communication and the smart infrastructures that will use during the COVID-19 pandemic in Korean society. Mr. Mungu Park, are you ready to deliver your speech?
Yeah, can you hear me?
Yes.
Okay, yeah, thank you for your introduction, Mr. Professor Lee. And I'm very pleased to be here as one of the speakers. Yeah, regrettably, we cannot meet each other physically, but I think we are quite accustomed to meeting each other virtually. That's good. Yeah. The agenda that I am supposed to discuss today is about the Korea measures against COVID-19. So I want to introduce these slides in terms of how to see and how to cope with challenges like COVID-19 in near future by having what. So I listed up here, medical logistics and rapid analysis and real-time communication. And lastly, smart infrastructure, smart manufacturing infrastructure. So I go to the next page. So the first page is talking about the healthcare system of a country. So some country has national healthcare service system. The other country has NHI system. But how to compare each other? So before COVID era, we don't need to compare directly because every country has its own story. But the COVID-19 crisis made us exposed to the same risk situation, and by coping with that, we can compare ourselves to each other. So I think whether to have a national healthcare system in terms of NHS or NHI is important. So I picked up their statistics comparing countries, the mortality rates, and a number of beds among 10,000 people, something like that. And next page is about the statistics we observed during the last 6 months. And this is the page that I want to spend a little bit more time. I don't think, so Korea is now coming across the second wave in COVID-19 crisis. So we don't think we are successful yet. We need to fight against the COVID-19 more and more by having more cautious measure and more cautious citizenship and the collaboration model among city, government, and companies thereof. Anyway, the speed of having this kind of tracking system in the city as a city infrastructure was important. The biggest successful measure that Korea used up to now was for sure, firstly, healthcare system. But behind that healthcare system was the Korea infrastructure had established this kind of tracking system. In some countries, tracking system is infringing some data privacy issues. So it can be it cannot be used freely. But in Korea, we had previously, before COVID-19, we had similar situation. It was another infectious disease was prevailing at that time. So National Assembly and Korea people and administration agreed with one act. So if there is a critical cases, critical contagious infectious syndrome is prevailing, then we'll have this kind of tracking measure to safeguard our society and country. So that was one successful point in that we had a enactment allowing the National Police Agency and financial information system and telecommunication system like a GPS. We integrate all those information to track confirmed patients and contacted person with those confirmed patients. So that was one story that Korea had, and National Ministry of Land, Infrastructure and Transport, MOLIT, they implemented this tracking system because they had big data infrastructure. Before COVID, they were establishing big data infrastructure in major cities. And that major city has this kind of integrating cloud system of all signals from the city. So that was another successful point to have a rapid tracking measure. So that was the story that Korea had. And by using that tracking system, we had this kind of patients, confirmed patients journey in the city in a day. So we are tracking 3-day journeys of those patients. And also we are extracting the contacted persons, contacted citizens with those confirmed patients in a day, in a journey that patients had. So by having those tracking system, we are distributing those information to notifying those confirmed patients and contacted persons, contacted citizens, for them to have a the visit the hospital and healthcare infrastructure to block any more to block their kind of pervasion anymore. So this is the main system that MOLIT, Ministry of Land, Infrastructure and Transport, built with Ministry of Commerce, Industry. And this is the 9 major processes that the tracking system has built in its infrastructure. And this is the screen copy in that tracking system infrastructure. So up to now, I was explaining about the, we need to compare country by country, which healthcare system is more powerful in dealing with this kind of COVID-19 or any other contagious infectious syndrome risk. And I was also picked up one example of tracking system. So citizen and National Assembly and government, they were agreeing with one enactment to allow in a risky situation, in a challenging situation where that situation threatens society and instability of stability of a country, then we can allow tracking our information if we are proven to be confirmed patients. So that was two major points that we need to think about, consider to cope with this kind of syndrome. Also, lastly, I was kind of point out, I want to articulate the importance of manufacturing supply chain. So as you know, Korea manufacturing industries are very famous in its speed and in its variety of manufacturing spectrum. So we have most the major manufacturing industries such as automotive, electronics, steel, petrochemical, and not only those major industries, we have medical supplies industry and all those rubber gloves or diagnosis kits or testing machines or walking through devices or drive-through devices. All those creative measures, devices invented by Korea healthcare system or Korea manufacturing industries are the result of that Korea has manufacturing supply chain which can operate in this emergent situation. All those manufacturing infrastructure can play their role in safeguard the one country's healthcare system. So this is drive-in system, which was very famous among the other countries that Korea invented without contacting the doctors or nurses or inside of hospitals. The suspicious patients or having that symptom, those persons are driving through the hospital or the outside of the hospital to check whether they are really confirmed patients of COVID-19 or not. So that was important. And this is app. I think right now, most of the countries are using this kind of quarantine measure guidelines and apps to trace each other. But the speed to cope with those syndrome or disease is important. So how to make one country to rapidly react upon this kind of risk situation. So how to make the country rapidly reacting those risks is important. So after all, so having this kind of bad memories like COVID-19 or the other infectious diseases, we need to have infrastructure of signals repository or database, big database to safeguard, to protect our society, our city, and our country. So we need to establish all those infrastructure because I think at this time of point, every country and every citizen may agree with this kind of point. And this is the 4 grids about the industries and companies. So which industry can survive after this kind of disease. So every country has different spectrum or portfolio of industries, manufacturing industries or infrastructure industries or even healthcare industries. So we need to rebalance our portfolio of industries to cope with coming future risk and similar situation. Yeah, so that's my agenda of today, and yeah, I want to discuss further with other discussants. Thank you.
Thank you, Mr. Park. Yeah, I forgot to introduce the background and the professional career of Mr. Park before his the presentation. And Mr. Mungu Park, and a partner of the Digital Innovation Center of KPMG in South Korea. He's leading smart city project and a smart manufacturing and a smart agriculture and other smart the domain, the national level, international level project in South Korea. He's in a nutshell is very smart in Korea, and by architecturing new transaction structure, leveraging behavior science by using digital and the data and technology. Thank you, Mr. Park. Okay, let us move on to the second presentation. The Miss Trace Lee, the senior data scientist, the Flow Minder is one of the best and the largest NGO, non-governmental organization, and civil, the society organization and the global society by taking full advantage big data to cope with coronavirus 19 pandemic. Ms. Tracy Lee. Tracy Lee.
Hello, my name is Tracy Lee.
Hello.
I work for an organisation called Flowminder, and today I'll be talking about how we've supported the government of Ghana in their response to the COVID-19 pandemic using the analysis of call detail records. Flowminder has been part of a collaboration alongside Vodafone Ghana and GSS since 2018, and Omar Saidu from GSS will also be giving a talk about this. This project has been generously funded by the Vodafone Foundation and the William and Flora Hewlett Foundation. And it was set up with a long-term goal in mind. That goal is to strengthen capacity within GSS in order to enable GSS to incorporate aggregated, anonymized mobile phone data into the production of official statistics. Now, the coronavirus pandemic began at the start of 2020, and at the start of 2020, we had already been working together for a couple of years. So we'd already made some good progress on our project, and in particular, we had an operationally feasible legal and partnership framework already in place. We had obtained political buy-in for the project, having a lot of engagement from many stakeholders. We had disseminated information about the project, not just to stakeholders, but also to the general public through press releases and media events. And this was particularly focused on ensuring that we were open and transparent about how we are using this data and being sure to address any concerns the public might have about the way that their private data are being used. Finally, we've done a lot of work on the technical infrastructure, and so we had a data pipeline set up that had data flowing in and data was being processed each day. A few more words on that data pipeline. Because we are working with sensitive personal data, it's very important to ensure that the data pipeline is one which can guarantee that the privacy of data subjects is preserved and respected at all times. So one consideration we use to do that is to make sure that all data is processed on Vodafone Ghana's premises using their hardware and within their system. In this diagram, we show a high-level overview of that data pipeline. It begins with the raw CDR data. That raw CDR data is de-identified or pseudonymized by Vodafone Ghana to produce pseudonymized CDR data. Vodafone Ghana then allow us access to that pseudonymized CDR data via a remote secure VPN. Because we're not based at Vodafone Ghana, we access remotely only. We can then aggregate and anonymize that pseudonymized data, and it's only this aggregated anonymized data, once it's been approved by all parties, that is exported out of Vodafone Ghana's system and used in external analyses. This is a setup which is compliant not just with all the necessary data protection legislations, but it's also compliant with Vodafone Ghana's requirements, and it has also been approved by the Ghana Data Protection Commission. One of the big advantages of mobile phone data is its timeliness. It's a data source that is generated in real time, and so there is no lag between the time at which an event occurs and the time at which you have data about that event. And we were able to exploit this timeliness because we already had made a lot of progress in our project. So we already had the infrastructure set up, we already had a governance framework in place. On this timeline, we show the events leading up to the introduction and then the lifting of various restrictions in Ghana. And the green dots indicate the times at which we were able to release reports and insights about the situation. The first report was released just 4 days after the introduction of lockdown restrictions. This was a quick report based on 2 key but simple to understand indicators. The first of these is what's called subscriber presence, which is the number of active subscribers observed in a particular location at a particular time. And on the top graph, we show how the number of subscribers seen in a commercial district each day varied over time. So you can see that relative to the baseline period, which is the period shown on the left-hand side of that graph, on the left-hand side of all the dotted vertical lines, after initial restrictions such as school closures were introduced, there was a decrease in the subscriber presence in that district. Then after lockdown, restrictions were imposed, which is on the far right-hand side, you can see a much greater decrease. The second indicator is based on travel and movement, and that's looking at number of trips between any pair of districts. On the bottom graph, we show how the number of trips between any pair of districts across the whole country changed over time. And again, you can see that after initial restrictions were introduced, there was a slight decrease, but after lockdown was introduced, there was a much sharper and greater decrease. Now, these insights could be obtained for all areas of the country, and as I've said, just 4 days after lockdown was introduced. And as I'm sure you're aware, if we were restricted to using only traditional data sources and traditional data collection methods, we would not have been able to obtain these kinds of insights within just 4 days. We released a second report after lockdown restrictions were lifted, and this meant that we could do an analysis based on comparing changes across 4 distinct time periods. Those time periods were the baseline period before any restrictions were introduced, the period during which initial restrictions were in place, the period during which lockdown restrictions were in place, and the period after lockdown restrictions had been lifted. On the plot shown on the bottom here, we compare how the number of trips within each region changed over each of these periods. And so on the left-hand side, this is the baseline period, that's the normal level. After initial restrictions were introduced, there was a slight decrease, a much greater decrease after lockdown was introduced, and then after lockdown was lifted, you can see that things definitely did not revert back to normal, back to the baseline levels. This report included some comments on policy implications, which were provided by the government statistician. And so in this particular case, the comment he made was that because the residents of Ghana had not reverted to their normal behaviour, even after lockdown restrictions had been lifted, they should be commended for being very aware and conscious of the way that their behaviour may affect the spread of the disease. We try to ensure that the work we do is always open and transparent, in particular being open about the way that data is being used. And so both of the analyses I've described are included in reports that are publicly available from GSS's website. More detailed information about the analysis methods is available from Flowminder's Covid-19 site. And if there is any further information that you would like to know which is not contained in either of those resources, then do feel free, please, to contact me, and I'll be very happy to respond. Finally, just a word about what to expect for the future. We do intend, so Vodafone Ghana, GSS and Flowminder do intend our collaboration to continue. Flowminder has been providing training to the GSS team in order to ensure that GSS have the skills to access and analyse the aggregated CDR data themselves. And together with GSS, Flowminder and Vodafone Ghana, we all intend to continue supporting the government of Ghana in the years, or at least the months to come. Thank you.
Thank you. Ms. Trish Lee, the data scientist and the project manager and the Flowminder, the data science and product manager, where she specializes in working with the mobile phone data to support the humanitarian and development programs. Thank you for this wonderful case. And I think that this is really, really important for sustainable development goals by using and data and even data collaboration and between the private sector and the public sector. So this the case that very meaningful to our audiences and participants. Thank you very much. Next is the Ms. Omar Seydou, the head of demographic statistics of the Ghana Statistical Service. Let me introduce Mr. Omar Seydou before his the presentation. Mr. Omar Seydou is a social statistician with about 20 years experience in the statistics production process. He has extensive expertise in survey sampling, the design of survey instruments, and implementation of sample surveys. He is also social and demographic statistics instructor. Mr. Omar is going to talk about the using, just a moment, the use of core detail, the records in the COVID-19 the response. Let me invite Mr. Omar Seydou.
Yeah, thank you very much, Professor Lee, and thank you for inviting me to be part of this engagement. Ghana is happy to be one of the first few countries in sub-Saharan Africa to have used this kind of data to respond to the COVID-19 pandemic. The project actually started way back in 2017 during the first World Data Forum, where that is where we initiated discussions around this project. And we started working closely with Flowminder, Vodafone Ghana in that period. And finally, in 2018, we had started real work around this project. In 2017, as I mentioned, Ghana conducted a data roadmap forum to try to understand how we're able to strengthen our data ecosystem to effectively and efficiently address the SDGs data needs. And coming out from that data roadmap forum, we had 3 key priority areas for action, and that is filling critical data gaps, increasing data use, and strengthening the entire data ecosystem. And so this project, which is Data for Good project, fall in the first priority of filling critical data gaps. And so we got Vodafone Foundation and Hewlett Foundation providing funding to support the implementation of this project. To date, the project has developed a use case with the National Disaster Management Organization. We have also created a legal framework that guides us on data sharing protocols between government and private sector. And we have also created a technical infrastructure for CDR data to be used in Ghana. And as Tracy mentioned, we're currently training 6 members of the Ghana Statistical Service staff in data science and how to use CDR data. Now, as Tracy mentioned earlier, Ghana got our first cases of COVID-19 on the 12th of March, 2020. And since then, we have been working with the Ministry of Planning. Interestingly, the Minister of Planning is the chair of the SDGs, high-level SDGs Ministerial Committee. And he had actually been one of the key people who has overseen this project starting. And so with the first cases on the 12th of March, and then the initial restrictions introduced on the 16th of March, we had a direct conversation with the Minister for Planning, Ministry of Health, and proposed how we could use the CDR data to help government intervene. And so we started working with them. And the Ghana Statistical Service, as usual, coordinated all the project partners, Flowminder, Vodafone Ghana, and the government team in trying to establish the initial use cases that Tracy has shown. So the first report came out on the 3rd of April, just 3 days after the initial lockdown. And then the second report was published on the 15th of May after the lockdown had been lifted. Now, sourcing this data has not come easily. As I mentioned, we started discussions around this project way back in 2017. And when we got ahead with this project with funding, we had to spend 13 months from November 2017 to January 2019, when we eventually had the agreement supervised by the Data Protection Commission of Ghana, established by the partners. And this agreement currently is in place till January 2022. Also, we realized that the National Statistical System did not have the legal mandate required for it to use big data. And so we had opportunity of reviewing our statistical law, which was eventually passed by Parliament in September 2019. And that has provided a legal basis for Ghana and for that matter, the Statistical Service, which coordinates the National Statistical System to use this kind of data source. We've also been able to establish the data pipeline, as Tracy mentioned earlier. Before COVID started, the data pipeline had been established between Flowminder and Vodafone Ghana. And so data had already started flowing through that. But of course, as at that time, we are unable to access data at the Ghana Statistical Service because we're still working in establishing the data pipeline with us. So Flowminder has purely been the one accessing the anonymized data and doing the analysis. The two reports that we released actually raised the profile of the project. And as we speak now, we've begun to receive some international requests and national requests for this data to subject it to further use. These reports have also been a catalyst for the inclusion of the Statistical Service in the policy space around COVID-19 in Ghana. So as we speak now, I have been called on to be a member of the National Technical Coordinating Committee chaired by the Minister of Health on COVID-19. And we could not have come to this stage if not for the analysis we did with this. At this stage, we cannot explicitly say that there's evidence of the analysis being used to change any policy, but then we know many decision makers have indicated the relevance of this and how they intend to use this to inform future interventions around COVID and maybe some other areas. Now, for post-COVID-19, the idea is for us to continue to work on this sustainably. And so the GSS strategic plan for 2020 to 2024 has adequately captured this project and the big data. And we are currently establishing a directorate of data science at the Ghana Statistical Service with support of ONS and other partners. In recent months, the API to the data pipeline has been built so that GSS can have access to anonymized CDRs through the FlowKit software that Flowminder has developed. Following the profile that we have received, quite a number of use cases are expected once we are able to make the data available to both internal and external users in the coming months. And also, we are looking to continue to publish quarterly infectious disease in collaboration with the Ghana Health Service using this. So thank you very much. This is my presentation.
Thank you, Mr. Omar Saidu. Very informative and a very meaningful case that has been very well addressed. Thank you very much. So, as announced before, we are going to have a session for question and answer Q&A. Okay. The three presenter address very important the issues and topics and the future, the directions we need to have in response to the COVID-19 and the pandemic. So right now, so I'm going to rely on the questions and comments on the platform that we are using. So I think Mr. Mungu Park received the two questions from the global, the statisticians. The first questions in the Mungu Park, how open are private sectors, the private entities, to sharing the data with the government? Are there incentives or legal mandates? These questions made by Mr. Oliver Mahoney in the UK. So, Mr. Mungupa, could you answer these questions?
I think it's the issue of social agreement. So whether citizen or national people are agreeing with each other, we prefer to having a certain restriction, even though we have a certain restriction or certain too much information released, private data is released to the public. If I agree with that, then it's okay. So each country has its own culture or its long-standing histories about protecting private sectors, so people, individuals. But in Korea, I think Korea people are a little bit yielding our kind of data privacy rights, replacing it with those social stability issues. So whether to whether to have countermeasure to cope with infringement or violation of such allowance will be different issue. But right now, whether the society has such agreement or not is important. In Korea, yeah, it was easily, comparatively easily agreed upon. But in other countries, it will take time, I think.
Okay, thank you, Mr. Park. So let me add the one point to his answer. The Korea is very unique ecosystem, ICT-based ecosystem, and culture and a normative ecosystem during COVID-19 and pandemic. The social consensus and public acceptance of the government-driven the data decision. The government policy is the for data use and the data sharing and the data integration is very well aligned with the government decision and the government leaders. So we are very positive about the sharing and his or her own the privacy information and the data that to be shared with the government sector to generate the solution and the new services that are very necessary to serve the protection and serve the control in terms of making necessary behavior changes in a very agile and a manner and even very transparent in a manner. So that is a unique and Korean culture and an ecosystem of data sharing that we can take a look at during COVID-19 pandemic. Okay. The further questions, the Mr. Mungupar, the one more questions has been received. The question is that, have you studied the impact of a tracking system in COVID-19 cases over the traditional, the method used so far?
So, so the question is whether the validity of the tracking system compared to the traditional measure.
Yeah, I think so. This question is the targeting at the comparative values of the using new kind of a tracking system, and that's incorporated by the government during COVID-19 pandemic. In comparison with the traditional method.
Yeah. I think because Korea is not doing tracing those information manually, it's about the automatic tracking using financial information such as payments or credit cards, and GPS information which is collected by the telecommunication companies. So integrating those payment trace and physical GPS trace, those informations are integrating each other for one confirmed patient, and finding out the other contacted persons having the same space and staying in the same space for more than 10 minutes, and sharing the same space and time zone. So I think it's quite valid and quite efficient measure to find those information. But Korea solved the situation in the first wave very efficiently and effectively. That's well known to the world. But the problem is right now just started about the second wave, meaning so we have time lag between when diagnosis kits are used for one suspicious symptom person, and then to find out whether he is really confirmed patient or not, it will take 1 or 2 days, at least 24 hours. It can be shortened, but averagely is 24 hours. That means within that 24 hours, that suspicious syndrome person can pervade his infectious disease to the others. So more and more, those tracking becomes difficult. So having only that tracking system is not working, I think. And the code of conduct for national people or citizen is more important. If I have a suspicious symptom, then I need to stay at home. I need to quarantine myself from the other people. Such code of conduct, good behavior is required more than by only having tracking system, I think.
Okay, thank you, Mr. Mungo Park. So while global sharing and collaboration of big data has reached unprecedented levels, and the challenges remain, the trust in at least some of the data is relatively low, and outstanding issues include the lack of specific standards and coordination and interoperability, as well as quality data and interpretation. Mr. Mungo Park, what do you think about Korean society, the coping with these issues when it comes to the making sharing and making integration and then making an increase in the level of interoperability and reusability and a data measure to generate new solutions and a very rapid responses to COVID-19 in Korea?
I think so. We are talking about the COVID-19 and the infrastructure established to cope with that risk of society or country. But I think we have really important, significantly important lesson learned. That means we are realizing the effectiveness and efficiency of tracking data. So right now, we are talking about just individual or data privacy related data, but there are data with no such kind of concern. So Korea government has already established smart city infrastructure and collecting information like IoT or CCTV, Vision AI, and the citizen behavior and the behavior change after some measures are taken. So having realized the effectiveness of having those data in one infrastructure, we can leverage that infrastructure to the other experience of citizen or the country. That means, what if those accumulated data is freely available with some protection of data privacy, but all the other data with no concern, without concern of a data privacy, we can make them released to the startups or social value companies for them to have other entrepreneurial measure or other business model of themselves, which eventually solves the city problem or some kind of a digital divide sector problem. That means even though we have, so the lesson we learned up to now is that, okay, the having data in one platform is very quite powerful. Then we need to find out where to use. So which business model or operation model or social value model can inherit that valuable legacy to give a birth to economic growth of a country, of a obsolete slum area of a city or agricultural province where no industrial kind of trigger can be found. So we can leverage this kind of infrastructure to make another echoing effect of a society or country. So that's my opinion.
Okay. Yep. Thank you, Mr. Mugapar. Let me summarize in Korean and a presentation and Mr. Mugapar's and answers to some of the questions. The strengthening contribution of big data to COVID-19 response in Korea, the Korean government and the private sector and multidisciplinary scholars do a good job in making adequate data governance models, interoperable standards, and the sustainable data sharing agreements involving public sector, private sector, and civil society. Actually, there are some incentives for researchers in Korea. The sustainable infrastructure and the human and institutional capabilities and mechanisms for access to data across borders. Thank you, Mr. Park. Let us move on to the question and answer, the stage regarding FlowMinder, Miss Trace Lee. Trace Lee, are you on the screen?
I am, yes.
Okay, thank you. The first question is how many services providers are there in Ghana? And does the data represent the provider or more? I think there's some. This question says some the fractured. Anyway, how many service providers are there in Ghana?
So there are three main mobile network operators in Ghana, which are Vodafone Ghana, MTN, and Airtel. And then there are a number of smaller ones as well. I think the question is about bias and representativeness of the full population. That would be my guess. So if I speak a bit to that, the answer is that if you have data from only one mobile network operator, then no, it is not going to be fully representative of all mobile subscribers or of the entire population. However, if you have large enough of the population included in that single data set, you can still gather some information and gather some insights as to what is happening in your overall population. And I think the point to emphasize here is that when you're in a situation where any information is better than no information, and certainly it's an urgent situation, you take what information there is available and you make the best of it that you can. Given more time, this kind of data can be combined with, for example, survey data. So survey data about phone ownership and phone usage in order to understand better exactly which areas, which segments of the population are well represented or not well represented in the data set. And this is something which can be done on a longer term basis. But with a very short time scale, as I said, it's a case of you take what data are available and you make the best of it at that given time.
Okay, please explain how reliable Vodafone data was in Ghana, and how did you generalize the result from one telecommunication companies to the total population?
When the question is how reliable is the data, from the perspective of technical reliability, so will the data be there when it needs to be there? We get a dump of data every day with a 24-hour lag. So for example, today we can see what was happening 2 days ago on Saturday. So it's reliable from a technical perspective. From the statistical perspective, as I've said in my previous comment, we know that Vodafone Ghana's data is not going to perfectly represent the entire population. In order to understand how it can be modeled, how you can use Vodafone Ghana's data to infer the behavior of the full population does require a combination with other data sources, including, like I said, surveys about phone usage and phone behavior. So this is a longer term effort, which is something that certainly can be and should be addressed in the months or years to come. But in the reports that we've released, we do include the caveat that we are not making inferences about the entire population, because we cannot with only this single data source, but that it's something that you must take into account when you interpret the analysis and when you draw conclusions.
Okay, yeah. So what kind of incentives for the Vodafone that have you arranged and have you maintained to keep them focusing on this global initiative you have designed?
So I'll speak to that a little bit and then maybe pass over to Omar, who may have more comments on this as well. I think the first question that was addressed to Mr. Park was actually also about what are the incentives for private data holders to provide their data. And I think when we in the community that works with mobile phone data and mobile network operators try to set up these kinds of initiatives, what you find is that there aren't any clear or obvious incentives for mobile network operators to be providing their data. In the case with Vodafone Ghana, what we found is that they have a very strong sense of corporate social responsibility. And through this project, as well as other social good projects, they are building up a very strong reputation as the leaders in corporate social responsibility. I think also having high impact projects like the one that I and Omar have spoken about, this is also elevating their profile and making them become perceived as thought leaders in Ghana for these kinds of projects. So that's how it looks from the perspective of implementers such as Flowminder, who are the technical partners. I don't know, Omar, if you have any more comments as well on Vodafone Ghana's incentives for continuing with this kind of project.
Yeah, I think you have rightly touched on the incentives. So what I probably would add is the fact that to ensure that we sustain their interest in this, the trust that exists between the National Statistics Office and Vodafone and then Flowminder has further enhanced that trust, and so ensuring that the initial incentive that existed for them to provide this data has continued. And even at this point, I can say that it has increased several folds.
Okay, the Ms. Traceley, the one more questions, and it goes to you. Could you expand a bit more about the applied privacy, the preserving technique?
Yes, so there's a slide that I included which showed an outline of the data pipeline. If I go through that again, there are several steps in that which ensure that privacy of data subject is preserved. Speaking from the technical perspective. Also, as I've said, there is a very comprehensive and detailed legal governance framework around this, which also ensures that everything we do is compliant with all relevant data protection legislations, as well as any ethical considerations that we might think of. So from a technical perspective, one thing that we do emphasize is that all the data is held only at Vodafone Ghana. So any data which can include private information about any individual remains at Vodafone Ghana within their system behind their firewall. The data that we have access to is pseudonymized data. So pseudonymized data is data which contains no directly identifiable identifier, So that's to say any, for example, phone numbers, names are not included. Phone numbers or identifiers of SIM cards are hashed. So they are translated from the original into a random string. This is called hashing or pseudonymization. And we at Flowminer have access to that pseudonymized data. So it becomes impossible for us to know which record matches an individual because we don't have the original identifier of that individual. In any case, we are not focused on doing any analysis of individuals. We are not trying to trace the movements of any individual persons. What we're trying to do is assess the overall aggregate movements of large groups of people, so of the entire Vodafone Ghana population. That's what we're trying to do. So when we do that, that's how we produce these aggregates, these anonymous aggregated data, such as the count of mobile subscribers seen in any town on any day, or the number of people moving between any two regions on a given day. That is the only information we're revealing. Because we're only looking at this aggregated data, there is no way of identifying any individual or making inferences about any individual from this data. Those are the key points for making sure that we are not invading any individual's privacy at any time, and reassuring all data subjects as well as Vodafone Ghana that the data are being used in a purely ethical and responsible manner.
Okay, thank you, Tracy. The much of big data with the most potential to be used for public good is collected by the private sector. As such, and a public-private partnership are likely to become more widespread. The challenge will be ensuring they are sustainable over time and that clear frameworks are in place to clarify role and expectations on a side. So I think your case is showing the very adequate the framework and roles and the missions and between private sector and a public sector in this very special case. Thank you very much. I want to ask questions from now on. Mr. Omar Seydu. Some people ask these questions. Just a moment. It's great to see the GSS playing a great role in central government. Do you have any thoughts on how the GSS will leverage this new position?
Yeah, thank you. I think we have already taken advantage of this. And as I did mention earlier, GSS currently is setting up a data science directorate that can sustainably use this kind of data and other big data projects. And we are also constantly in touch with government. Now, one important thing I need to mention is that when we started this project, we made sure we engaged widely with government. And I recall in one such meetings, the Minister for Planning, who coordinated the SDGs Ministerial Committee, referred me to the Attorney General to ensure that we are not stepping on people's privacy and all that. And so after explaining the processes to them, they did appreciate the fact that this data is good and it is something that can be used for a public good. So with the coming in of COVID-19, one interesting that happened is that the minister immediately remembered that, oh, Omar and his team had already spoken to us about this data. So let's talk to them. Probably we can use it to do contact tracing. Then, as Tracy mentioned, then we told them, yes, we can use it, but not for contact tracing. But it can be used for these other scenarios where we have the aggregated information. The contact tracing will mean going into individual level data. And so with all these things and the engagement we're currently having with the Ministry of Health, we realize that the Ministry of Health want to collaborate more with the Ghana Statistical Service now than ever before, because they see the need for this data for tracking infectious diseases, for instance. And as I mentioned, there is a plan to work with the Ghana Health Service to produce quarterly infectious disease publications starting from this quarter. So we actually taking advantage of it, and we obviously are going to ensure that it becomes part of our data infrastructure in Ghana.
Okay, Mr. Seydu, the one more question. How was the financial arrangement for the implementation, the Ghanaian experience made?
If I understood you correctly, you're looking at a financial arrangement.
Yeah, so the 8th asked this question, yeah.
Exactly. You realize that, as I mentioned earlier, this is something entirely new to our statistical system. And coming from a developing country where statistical offices usually do not get the required budget even from government to implement their routine activities. Sometimes it's difficult to get a government to say, okay, we're giving you money to explore new areas. But once we went into the data roadmap and we were very clear on what we wanted to achieve, we started approaching other partners within the space, a philanthropic space, and we got some to be interested in supporting this project. And so once we had the initial funding from Vodafone Foundation and Hewlett Foundation, and we started producing the use cases. As we speak now, the government has gotten a facility from the World Bank for the National Statistical Office for the next 5 years. And there's funding in there for this project to continue. And that means if we had not established these good uses of the project, obviously government wouldn't have seen the need to some funding. And so we believe that as we go forward, there would be more funding from government for this and many other such projects.
Okay, yep. So just a moment. Let me give you the last question to Mr. Mungupar. So you have received a number of questions from participants. Mr. Mungupar, last question, on the list. Can you explain how does your work relate to statistics and statistician and a statistical office?
It's about the data. So right now, is it echoing? So, the data that I mentioned was not captured yet. The Department of Statistics, but because there is time lag. So we are talking about how to leverage data infrastructure and how to find out the people's or citizens' behavior change if those data can be of importance, of meaning to the government, and the government wants to utilize that data to find out economic growth, then I think Department of Statistics should find the algorithm and patterns and insights from it, and how to release those insights among to the public. So the statistics has many ways which can be meaningful to the Korean people, and even though the structure, the infrastructure and data that we were talking today was only concerned to the COVID-19 situation, I was mentioning about to link that lesson learned to the economic growth. In that respect, I think Department of Statistics should, Bureau of Statistics should find out the ways to let Korean people to know the importance.
Okay, thank you. Right now, I'm going to invite our fourth panelist. The name is Frankie K. Miss Frankie K, the interim deputy national statistician, the Office for National Statistics, the UK. Miss Frankie K took up post as interim deputy at the national statistician and director general for data capability in July 2019. The Frankie is responsible for the capability of the Office of National Statistics, ensuring that everybody has the technology and skills to enable them to their job effectively. She is leading the digital and workforce transformation to allow ONS, the Office for National Statistics, to collect, securely store, and analyze the data from news sources. The Frankie champions openness and data sharing for the public good in ONS and beyond. Ms. Frankie K, are you ready to share your insight and case with us?
Yeah, absolutely. So if you could just move on to the first slide.
Yeah.
So, so in the UK, in about May of this year, the UK set up a new joint biosecurity centre, which is responsible for identifying and analysing COVID outbreaks in the UK. And as part of that effort, ONS stood up a multidisciplinary team so that we could help identify COVID hotspots. We built a new secure environment in less than 3 weeks. And within that environment, there's a publication area where approved users can see approved data so that we make sure that it's very secure and that only the right people can get access to that data. We are intending to turn that learning almost into a product so that we can use that to support others that have similar goals and make sure that we take the learning and be able to apply it in other situations. And on this platform, we're assessing novel data sources which can be used to predict or act as early warning indicators for COVID outbreaks in the UK. So these include wastewater data, also the sale of pharmaceutical products, and also information from something called the Zoe app, which is a tool for people to self-report symptoms and has had about 3 million downloads. We take that data and then also feed in other risk factors such as population density, mobility, employment type into those models so that we can try and predict what will be happening in certain parts of the UK. We also look to benchmark those data against a measure of prevalence in other sources, such as the ONS's massive new COVID infection survey, also the death records and cases, infection cases from other sources, including from the health system. There isn't a silver bullet to this, so we looked to combine those information from the different approaches. And also we look at different approaches to both modelling as well, so that we can try and find different ways and different perspectives. We then share that data and work with our colleagues at the Joint Biosecurity Centre so that they can view those in automated dashboards, and then they're making very much feeding into the decisions in terms of local lockdowns in the UK, of which there have been several over the last couple of months. We also look to share those reports and then share code as well where we can. You could just move on to the next slide. So I don't think I ever expected to do a presentation where I started talking about feces. So that is a new experience for me. But one of the things that we have been looking at is monitoring sewage water. And this is obviously quite an interesting and novel new data source. And we've been looking at that partly as a result of the paper published by Sumitri Malapati in April of this year in Nature. And that was looking at the fact that you could analyse wastewater and detect COVID-19 in populations. So what is happening is that we are, or the researchers are monitoring the viral load in that wastewater, and we think it's got the potential to be a useful indicator of prevalence in the population. And this can be particularly helpful where the take-up of testing has been low, or we are trying to understand asymptomatic patients. There are some drawbacks to this. It's not particularly easy to quantify the scale of the infection, as there are many factors that need to be understood. So, for example, how much of the viral load is actually shed in faeces, and also in different local water treatment plants and different catchment, you can get different conditions such as different weather and different chemical composition. So over time, we are going to we need a longer time series to really understand how valuable this information is and how good an indicator it is. And it will require significantly more complex data. In terms of the chart on the slide, to give very much credit, this is our colleagues from the Dutch National Institute, as we're not quite ready to publish our data yet. But there definitely does seem to be a correlation. So if you look at the orange line, it's the concentration of the viral concentration. Blue is the new cases, and grey is the hospitalisation. So there is quite a strong correlation. If you could move on. So in terms of, one of the things that we did quite early on is also look in terms of understanding the impact of lockdowns on people's mobility. So were people adhering to the guidelines or not? And Google, to help us do that, Google released data for about 131 countries at different national and regional levels. And they were looking at different types of places. So it was residential, workplace, retail, and so forth. So this was derived data from those who turned on their location history. To be clear, a little bit like Tracy was saying, all the data are aggregated and anonymised, so we don't know anything about any individuals. The key challenge, though, for this was that it was initially released as a PDF. So the campus team worked to convert those PDFs to machine-readable CSV files, and they managed to do that within 48 hours, which is incredible. And then they also made that code available via GitHub to people around the world. And actually, interestingly enough, Google sometime after did then change their format from PDFs to CSVs. So we've been using these data. We've also been supplementing it a bit like Ghana and other sources such as telecoms data, so that we can really get that understanding in terms of the impact of lockdown, both the initial all UK lockdown, but then more recently the localised lockdowns. So we have also been combining this data with card spending data so that we can understand the impact of lockdown and the reduced mobility on local economies. And again, if you could move on. We've also been, obviously, a key part of what we've been doing is trying to understand the impact on the economy of COVID. And actually no part of the economy remains untouched by the impact of the virus, and that's what we've seen in our analysis. By May, we had stood up a business impact survey, and that had shown us that around 1 in 4 businesses had temporarily stopped trading. And therefore, one of the things that we found we were concerned about in terms of being able to measure the impact on the economy was our normal route through business surveys. We were concerned about the potential bias that was being introduced, because there obviously could have been a large number of businesses that were not responding as they had temporarily or permanently closed down. So what we wanted to do was take the widest different sources of data so that we can understand the performance of businesses. So this included working with the private sector with a company called Glass.ai, so that we could read the COVID notices on businesses' websites. And we did that for more than 500,000 businesses so that we could understand their trading status. So we were looking for things like keywords such as coronavirus, and we then used NLP that we could classify those snippets according to the response of the business. So we were taking the record level data from business websites and then combining it with other data sources. And what this also helped was actually to feed that through to our colleagues who work on the business surveys and collecting data that way, so that they could more target their response tracing more efficiently. So if you could just move on. And then finally, we wanted to try and understand what was happening about weekly vacancies. So we have been working using Azuna data. Azuna is an online search engine which looks around collecting a sort of information from thousands of different data sources about vacancies. And clearly, like many other countries, the impact of lockdown on UK business and employment has been really dramatic. And therefore, using this data from Azuna has been able to create a very rapid, high-frequency indicator of job vacancies in the UK. So this is one of several different administrative data sets that we're using to explore faster indicators on the economy. We've also been looking at revenue data from the tax authorities, road traffic data, and also shipping data, which is in development at the moment. So that Azuna data, we were able to categorize that into both regions and also different categories like healthcare or nursing, IT, and so that we could try and understand the different impact on different sectors of the economy. And this data source is really timely compared to surveys, because we're able to publish this within 6 days of the extraction from Azuna's systems, and we publish this weekly compared to the slower monthly survey. And we're using this information to proxy job vacancies, and we're presenting it as an index, which is using 2019 as the baseline. And you can see from the charts that there's just an absolute dramatic dropping off a cliff in terms of the light blue lines in the 2020 index, with almost a sort of vertical line drop in pretty much all different sectors, other than perhaps what you would expect, healthcare, but even that did drop. We can only use these adverts as a proxy for vacancies. The data is limited in that the adverts don't necessarily correspond to the number of vacancies. Somebody might be advertising for multiple posts, for example. And different businesses use online adverts to a greater or lesser extent. And therefore, that's why we've chosen to present this as a relative indice for communicating what we're doing. Future work is also about matching those adverts to both SIC and SOC classifications, so that we can try, and also we want to try and extract information on key skills, so in different categories, and see how those are changing over time as a result of the COVID. And that's what we've been doing in the UK. Thank you very much for the opportunity to share that with you, and obviously very happy to answer any questions.
Thank you, Ms. Kay. Okay, yep. The UK case is extremely wonderful and very scientifically designed for the sharing in the data across border, the cope with and the COVID-19 and the pandemic. Okay, the last, the panelists, they should be invited. Let me just a moment. The last presenter, from Estonia. The name is the Mr. Mart Megi, Director General Statistics Estonia. Mr. Mart Megi has got more than 25 years of managerial experience. He was worked as a business manager and chairman of the board of PricewaterhouseCoopers Advisors. Recently, he is the uh, he was the head of the Swedbank in Estonia asset-based financing and insurance business unit. As of 2017, he works in Statistics Estonia as Director General. Mark is a member of supervisory board of several companies and foundations. He's going to talk about uh, monitoring mobility during country lockdown. Let me invite Mr. Marty Megi.
Thank you. Thank you, Chair. Thank you, the delegates. It was really nice to hear about the experience of Ghana. It was really nice to hear experience from Francesca from UK. So I will give a quite a similar, but due to the situation in Estonia, we have a highly digitalized society. We are able to really move, in some cases, a bit further even, but let me share our experience with you. So we, as a Statistics Estonia, we was involved in a very early stage due to this digitalization. So we was supporting and helping the central government to monitor and impact or doing the impact analysis for the full COVID-19. So as we was appointed immediately by the cabinet as a central coordinator and producer of different social indicators, it was also clear for us that we need information which is totally different from our past experience. It means that we had to really get via our X road or from the different sources, the information or the data from the different sources, like a big data on a daily basis, and provide also different indicators on a daily basis to the government. So the Estonian case clearly showed that there is a real need, and it is time for the changing in NSIs so that we can support different situation in a country to get a more accurate access to the privately held data, and also to supporting with the information the relevant decision making in a society. But let me share you one clear example of what we had really experienced during those last couple of months, and that was experience related to the mobility data. So the purpose of the mobility analysis was give a clear overview, as requested by the Prime Minister of Estonia, about the situation which was declared in 12th of March 2020 in Estonia, until the end of the lockdown on the 1st of May 2020. So the Cabinet of Estonia requested Statistics Estonia to analyze mobility data, anonymized mobility data, during this period, and contribute to the understanding, are those lockdown rules really operational? Are those different situations which appeared in Estonia, are they large ones, the cases, or they can be really locked on a smaller areas? So we provided information within 14 days based on all mobile operators' data back to the government. So it was very, very fast. And also it's covered all 3 mobile operators. And the data was provided to the government and to the public on the lowest or the smallest administrative unit on a daily basis. So we have used the mobile data also in the past. In Estonia, we have used the mobile data in terms of the calculating a tourism. But that was totally different. That's mobile data which was coming from the mobile calls or the SMSs. Now we obtained first time the signal data. So we got the information from all the operators on a daily basis from the signaling itself. And we were able to provide information in relation of the location, time spent, average distance traveled. Interestingly enough, as Francesca mentioned about Google, we also got the Google report almost on the same day when we published our report. And we were able to compare the Google report and our own report based on the full coverage. And what we can see clearly on the statistical side, the Google does not cover the full state. The Google can show some, or in some cases, very close figures, but it's not really the full picture. In getting all the information and also publishing this kind of information, it is reporting, it's very huge communication project, I would say. Because we had also daily interviews about how we are maintaining the trust. Are we really based on the GDPR, which is in Europe? It's very strict rules about confidentiality and personal protection. So that was even the biggest project in terms of communication that it was from the technical side of view. But before showing you or giving you overview about communication, I would say the hardest and really crucial part of the project was also in a very short time run to develop a proper methodology. So we, together with the Position, and also in this case, together with the operators, developed this new methodology. Of course, I think it is something what we need to discuss also on a global level, how we can really engage all mobile operators, because in Estonia, similar to the other countries, it wasn't mandatory to give the information. So we had a good opportunity and high social responsibility in Estonia. So we got the information from all mobile operators. But it is important that in those cases, we are sharing openly the methodology, and we can show the benefits of this particular project to the society. I think similar to Korea, it is very important also to really gain the trust of the citizens. And that's mean that you need to give a clear understanding that none of the personal or persons are not tracked, but it is giving an overview of the situation and supports the relevant decisions made by the cabinet. So it is a huge and important project between the public and private sector. And it is also was demanding a lot of capability in terms of analytical capabilities from all the sides. So it was, interestingly enough, but in all mobile operators, they had a data scientists. Position had data scientists, and we had a data scientist. And it was enormous project to working together, different parties, both in terms of methodology, but also in terms of the communication. So I have a short conclusion on it. So the conclusion is that the communication of such kind of project is even the major part of the full project. It is starting, of course, with creating a win-win partnership with the policymakers, with the government, but also with the private sector. We saw that we need to build and maintain the trust in all areas using the big data. As I mentioned before also, we're using not only the mobile data, but we are experiencing also the electricity data. the water data, and also in terms of the banking data. So it is important in all those cases to really provide open and understandable overview of the data, how it's used, and for what purposes it's used. So it is important that we are really widening our activities because the need is clearly changed. The mobility case also shows us that we need to provide information not anymore on a monthly basis, but I will say sometimes on a weekly or a daily basis. And that's something which is currently NSOs are not ready, or we are not ready, so that it needs a huge shift also how we work operationally. And even I was a bit critical in terms of the comparing the information with the Google. I still think that it is important to create a new partnership with the international community, because the information what we got from there, it is important to compare our own data and also to leverage our own data. Thank you. That's my short intervention. Thank you.
Thank you, Mr. McGee. It's very informative and a very nice address in the last the panelist session. The Frankie K. Let me ask you questions. Two questions received. The first question is, how does ONS plan to keep this momentum going in terms of acquiring and utilizing alternative sources of big data?
Yeah, no, that's an excellent question. And I think part of it is, so there's two aspects. I definitely agree with Mart. There is something around ensuring that you build up that public trust in terms of being able to use those alternative sources, so that the public are aware and are comfortable that their data is being used safely and securely, and also ethically as well. And part of this is actually to take the relationships that we've needed to build up with the suppliers of that data, be it financial transaction data or mobile phone, and then keep those relationships up on an ongoing basis. In the UK, we do have a legislative right to private sector data for statistical and research purposes, through an agreed governance and framework, through ethics, security, and so forth. But we're kind of reluctant to end up to really fall back on that data, that legislation. So it's all about building up those relationships, and I suppose showcasing what good can be done with using that data, and that it is done anonymously and it is done securely, and that the impact that can have. So, for example, we're thinking about setting up things like citizens' juries, so that we can talk with the public directly in terms of how we want to use their data for the public good. So, yeah, sort of really building on those relationships, showcasing examples. And it is really important that we don't lose the momentum that we've gained over the last few months.
Okay. The Ms. K, as one more questions, are you going to continue publishing data from the new data sources in the future?
Yes, absolutely. We'd like to publish more. We'd like to publish more than we do already. There is some data that we use that at the moment is mainly around providing internal advice to government, and we'd really love to publish more of that data. But obviously, we do need to do it in agreement with the suppliers of the data. So, absolutely, and we're working on a couple of quite sort of big initiatives with the ONS. We've just launched our new strategy in terms of our next sort of 3-year strategy. And part of that is about providing a platform, an analytical platform for both within data, but also within government, but also to researchers and others, to try and make as much of this data available and be able to link it together for research and statistical purposes. So yes, the more we can publish, the better.
Okay. The Ms. K, one more question. It is believed that it is said that an adequate human capital and institutional capability are in place to manage, create, curate, and reuse the open government data and the private sector data, so both in individual institutions and institutions that act as data aggregators, whose role is real-time curation of data from different sources in the UK. For example, the Government Digital Service and the Center for Data Ethics and Innovation and Alan Turing. There are many actors and players in the data governance of the UK societies. But how do these public bodies and private sectors collaborate and work together in terms of policy coordination and inter-organizational collaboration?
Yeah, it is quite a complex landscape in the UK.
Yeah.
And one of the things is that the government will be shortly publishing a new national data strategy. So I think that part of that will be looking at how do you provide that overall coordination. I mean, at ONS, we work very closely with the Alan Turing Institute. We work with the Centre for Data Ethics and Innovation. So it is a matter of trying to sort of navigate your way through that system, lots of working together, and it is about building those partnerships and those relationships up so that you've got the right connections and that you're making the best use of expertise right across the UK, because certainly nationally, we at ONS don't have all of the expertise or indeed all of the resource. So it's looking about building partnerships. Another one we're looking at the moment is working with Health Data UK Research, which is a charity, in terms of looking at creating a set of core studies for the next phase of the COVID pandemic in the UK, so that we can make sure that both the data is available in terms of doing the research. So it's lots of different partnerships and making sure that we're as open and transparent with the data. And again, the sort of platform I mentioned earlier, if we're able to get that available as quickly as possible, then that's another way that we can partner with lots of different types of organizations.
Yep, thank you. Mr. Maggie, the one question is that will you continue the cooperation with telecommunication providers after this crisis?
Yes, I mean, yes, we are continuing. We are not publishing any more results after the end of the lockdown, but there is really readiness. As soon we will have a new lockdown, for example, to support us once again and provide once again the information to the society. But the information and the cooperation is not only related once again with this particular project. I think we need to work further with the mobile operators also in the future, because there is a different indicators relating for the example like migration or the tourism. They are also kind of dependent about the mobile data. So we are working on a larger scale.
Okay, yep. The second question is that the trust issue, the public trust in government is a critical factor in data-driven policymaking and public service design in response to COVID-19. You talked about the concerns about access to data. How important is trust in methods and models you have mentioned?
Well, the trust issue is very high. I mean, once again, it's also in our case, we started the project particularly with the public discussion. The issue is in terms or in a times of pandemic, it's very hard to have in a very short run a proper discussion with the publicly with the full transparency. So therefore I'm saying it is important that we are keeping discussions up and running, even there is no particular time of pandemic, because next time it can be something else. It can be climate change issue or something else. So it is important that we are trying to build a trust as a government, but not as in a society in general, so that we are sharing the data between us for the benefit of society.
Okay. UK and South Korea and the Netherlands and Finland and even Estonia. So these countries quite strong in digital government. So in terms of OECD and a digital government indicator, Estonia has demonstrated a very unique and a very strong success cases in front of OECD member states and as well as a UN and a member countries, securing adequate infrastructure, including data and software repositories, computational infrastructure, and digital collaboration platforms, but very important too. The coming the days of coping with the COVID-19. Could you kindly share a bit of the future outlook and the leadership you are going to exercise in front of the citizens?
Francesca, do you, or
Oh,
I can...
yeah, no, you go first.
Yeah,
Sorry, I
maybe,
wasn't sure
yeah.
who that was. Sorry.
So yeah, support. Yeah, UK and Estonia.
You go first, Mart. I'll see.
Okay. What we are really currently on discussion is about the data governance. And the data governance is really consisting of major different, I would say, blocks or parts. One is how you obtain the data. The second one, how you keep the data. Then how you analyze data and how you disseminate data. So the blocks are very important all. But what I'm saying in a data governance, that is a very crucial part, which is also in terms of securing the data, what is on or provided for this benefit of the society. So overwhelming, I would say, headline of it is all about data governance and how the data governance, in addition to the digitalization of the country and interoperability of the data, should be put on place. So that's something what we are trying to also, on an international level, to give a kind of hint how we have done at least the data governance in Estonia. And the parts and pieces of it is important that they're all on place, because you cannot go very far with the interoperability without not thinking about security and not about thinking about the statistical confidentiality, for example, as well. So I would say, different blocks, and you need most of them before you can take next step.
Okay, thank you.
Yeah, and I would definitely agree with that. I think in the UK, we sometimes look at Estonia with envy in terms of your ability to pretty much just use administrative data and be able to link it together because of common identifiers, which we don't have within the UK. So therefore, for us, there are some of the challenges as to how do you link different data from multiple different sources, just within government where we don't have common identifiers. So there is definitely, and that's something on a sort of global, I guess, scale as well, that you can think of things like Glebe, where you're trying to, certainly from a business point of view, use common identifiers to help with trade and those other sort of international aspects. So we are looking in the UK about trying to strengthen our data standards and interoperability so that we can, at least within the UK, share data more effectively and more efficiently. Whether that can expand in any way into the private sector, I'm not sure, but that obviously would make it significantly easier if you were able to try and have that more common standards to have the interoperability. And it's not just in terms of data for us, it's things like standards around APIs or microservices, so that you can try and do in terms of not necessarily bringing all the data to the National Statistics Institute, for example. We're thinking about how can you try and do some more of the compute and processing actually within the source system, and then bringing the aggregation back to try and alleviate some of the security issues that Mark was talking about. So that's something we're considering and looking at the moment as well. But I would agree, it is all about sort of security, governance, interoperability is really how we're going to make this work much more efficiently and effectively.
Okay. Yeah. Thank you.
Just to add
you,
as
Mr.
well, I
Yep.
mean, it's really important also that the cooperation with the universities or the research agencies are on place, because the in-house capabilities is certainly not enough. And we're getting more big data than we can never ever, I mean, analyze. So therefore, it is really important, the cooperation with the research agencies. So and building up the so-called cooperation capabilities. So the way how we are operating should be really more together with the private sector and with the kind of research institutes.
Okay, thank you. The great answer. Okay. Yep. It is time to say goodbye. Before I say goodbye, I would like to express my gratitude to everyone for your participation and for your the question and for your wonderful interaction, and particularly the 5 presenter for the speech. I ask for your continuous interest, participation, and the communication for the challenges of the humankind to overcome the COVID-19 through behavior change and policy dialogue and further research effort on the ground of data and evidence. So thank you, everybody, and I wish you all the best of luck in the future. Bye-bye. I have an announcement, and considering the staging and the maintenance and the broadcasting issues, the session 3 is expected to begin in 5 minutes. Please kindly understand that. I hope that you find no difficulty in attending the next session. Thank you very much.